Artemis Hospitals, a 400-plus bed super specialty medical center located in the heart of Gurgaon. Every day, it caters to patients coming in from all over the world to avail treatment across our 40 specialties and 11 centers of excellence. With more than 400 full-time doctors and state-of-the-art 9-acre campus, we are committed to provide advanced health care. We endeavor to provide the best of medical facilities and comply with the international standards. Artemis is the first hospital in Gurgaon to be accredited with Joint Commission International. We are also accredited by NABH, and our high-tech laboratory service is NABL accredited. Artemis Agrim, Institute of Neurosciences, is a combination of world-class equipment, facilities, and a team of dedicated neurosurgeons, neurologists, neurointerventionists, neuroanesthetics, neurocritical care, pain specialists, all under one roof. We aim to deliver a multidisciplinary approach comprised of integrated practice units to treat complete range of neurological conditions ranging from brain tumor, spinal disorders, stroke, epilepsy, brain aneurysm, arteriovenous malformations, movement disorder, headache, and head and spine injuries. Department of Neurosurgery at Artemis Agrim, under the aegis of highly experienced surgeons, offers some of the most sophisticated surgical treatments for tumors, traumatic brain injuries, spine diseases, and spinal injuries, along with a variety of advanced approaches like deep brain stimulation, spinal cord stimulation, epilepsy surgery, neuroendoscopy, and baclofen pump to restore health of patients and relieve their pain.
Neurosurgery is a field in which not only do we need good training and good equipment, but also we need good infrastructure and a lot of good technology. So in neurosurgery, what is really helping us today is a technology called navigation, which allows us to offer surgery which is not only very precise, but it is also very comfortable for the patient in the sense that we only make a very small incision located at the correct place, and with that the post-operative comfort and pain freedom of the patient is very high. So cyberknife radiosurgery has helped us to revolutionize the management of many benign and also malignant brain tumors which no longer need surgery, and they can go home the same day after having had their treatment.
Artemis Neurology Department follows interdisciplinary approach that goes beyond prescribing medicines. It offers a comprehensive treatment and management of chronic headaches, epilepsy, movement disorder in children, adolescents, and adults.
Headache is one of the most common disorder for which a patient presents to a neurologist. Unfortunately, headache is the most underdiagnosed and even more undertreated condition. We at the headache clinic at the Artemis Agrim Institute of Neurosciences take headache very seriously. We offer a single point, most comprehensive treatment for all types of headaches across the ages, whether they're children or older people. We offer simple medication, we offer Botox, we offer radiofrequency ablations, we offer trigger point blocks, we offer sphenopalatine ganglion blocks to occipital nerve stimulation for patients with chronic cluster headaches, and we go to the extent of offering gamma knife and cyber knife for patients with trigeminal neuralgias. It is a one-point solution to all sorts of headaches across the ages. About 1% of people in India suffer from epilepsy. Unfortunately, there are not many centers who offer a single point solution for epilepsy problems. For epilepsy, you need a good video EEG machine, you need a good quality MRI, you need a SPECT and a PET scan, but most importantly, you need a team which consults of epileptologists, epilepsy surgeon, a neuropsychologist, a neuroradiologist who can understand the epilepsy in total. We at the Agrim Institute of Neurosciences at Artemis offer a comprehensive epilepsy program in which patients with simple forms of epilepsies to most complicated epilepsies which require epilepsy surgery can be evaluated and offered all types of treatments. We have done more than 350 epilepsy surgeries. We have done deep brain stimulations. We have done innumerable video EEGs, and we have offered the best possible treatment which can be done anywhere across the world for patients with epilepsy. Movement disorders are neurological disorders in which there are either less movements or more movements of the body. Disorders like Parkinson's disease, writer's cramp, blepharospasm, cervical dystonias, they are all in the realms of movement disorders. We at Artemis have the facility for doing simple to the most complicated and the most sophisticated treatments for these patients. We can offer simple medications, we can give Botox for patients with all types of movement disorders, and we do deep brain stimulations for various types of dystonias and Parkinson's disease. In our center, we have done more than 300 such surgeries for patients with Parkinson's disease using deep brain stimulation.
Department of Neurointervention is a part of Comprehensive Stroke Center at Artemis Hospitals. The center operates 24 hours a day, 7 days a week to care for patients who may require treatment for stroke and neurovascular disorders. In addition to this is a leading-edge 3D biplane angiography system, giving our specially trained neurointerventionists the ability to treat an array of endovascular issues such as aneurysms, arteriovenous malformations, and emergency stroke, etc., while also having the ability to perform a variety of spinal procedures.
Artemis Agrim Neurointervention Unit has among the largest experience in treatment of brain aneurysms, acute stroke, arteriovenous malformations, and carotid stenosis. We have a team of 3 full-time neurointerventionists so that we can provide the round-the-clock services for patients with brain hemorrhage and acute stroke. The 3D biplane neuroangiography lab not only has 3D angiography, inbuilt CT scan, but it is an ultra-high, low radiation system with a high-resolution screen to provide the best imaging for these patients. And we are very well supported by our neurosurgery colleagues, neurology team, stroke team, and neurocritical care team. So the whole attempt is to provide the best outcome for the patients with stroke and neurovascular disorders.
The use of O-arm has revolutionized the treatment and the outcome of spinal disorders. It acquires the real-time data pertaining to an individual's anatomy and assists the surgeon in navigating through spinal procedures with unparalleled accuracy. Its availability has enabled the Neurospine team to perform state-of-the-art, minimally invasive keyhole spine surgeries with more than 99% safety and accuracy.
The Neurospine program at Artemis Hospital is a comprehensive, one-of-its-kind program in the country where specialists of a variety of specialties related to the spine like orthopedics, rheumatology and endocrinology and physiotherapy come together not only to provide the right diagnosis but also to provide the right treatment to each patient. As a result, the institute has become one of the major referral centers for patients with spinal problems not only from various parts of India but also from a variety of other countries in the Gulf and beyond.
The Department of Neuroanesthesia and Neurocritical Care is a very important extension of the Institute of Neurosciences, taking care of OT, ICU and pain services.
Neurocritical care is an emerging subspecialty of intensive care, which involves multi-system care of critically ill neurological patients. Neurocritical care involves intensive neurological monitoring like transcranial Doppler, ultrasound of brain, and also knowing the CT scan and MRI of the brain. This specialty caters to neurosurgical patients, intervention neuroradiology patients, and the advanced neurologically ill patients with a special focus on stroke, intracranial hemorrhage, and subarachnoid hemorrhage.
As a testimony to our vision as the leading healthcare provider of choice in Delhi NCR, Artemis Hospitals continues to innovate and establish standards of healthcare in India. We are proud of providing exemplary advanced care to the community.